At Prevent Blindness, we promote healthy vision and access to eye care for all. We educate people about protecting their sight. We advocate for strong vision policies at the local, state, national, and global levels. We empower the blind and low vision community and their allies, and we celebrate their achievements. Here's your host, Christopher Horde.
Greetings, and welcome to Prevent Blindness Focus on Eye Health podcast. Prevent Blindness observes August as Children's Eye Health and Safety Month. As part of that observance, we're going to discuss federal legislation that has the potential to positively impact vision and eye care for children throughout the United States. We'll also guide you to resources we've prepared on children's eye health and give you a preview of next month's podcast. I'm your host, Christopher Horde. Stay tuned. It starts right now.
News.
Prevent Blindness invites you to join us for the second in our annual webinar series. Prevent Blindness plays many roles in your community, but one of our most important roles is as a clearinghouse of information for patients, medical professionals, advocates, and organizations. It is in this spirit that Prevent Blindness invites you to join us for a free webinar about eye care policy. The webinar is entitled Collaborative Solutions for Expanding Eye Care Access in Special Populations. The webinar will be on August 6th from 2 p.m. to 3:30 p.m. Eastern Daylight Time. This is the second of this year's Prevent Blindness Focus on Eye Health webinar series. In a roundtable discussion, panelists will share success stories and actionable techniques to help spread eye care services to every facet of our society. Once again, the webinar is free of charge. To reserve your ticket or find out more information, visit our website at preventblindness.org and check our events calendar, or click the link in our show notes. Prevent Blindness observes August as Children's Eye Health and Safety Month. Children are our future, and many studies have shown that getting children proper vision screening can be a crucial part of their development. This is why Prevent Blindness observes August as Children's Eye Health and Safety Month. We invite you to visit our website at preventblindness.org. There, we have gathered a great deal of information on this topic. Learn more about vision health issues that affect children. Learn the signs that your child may have vision issues. Learn how to help prevent children's eye injuries and about eye health in general. If you would like to know more about this important topic, please visit our website or click the link in our show notes.
Feature presentation.
Today we have some special guests on our program because of the focus on children's eye health for this episode. We're going to talk today with a couple of experts from Prevent Blindness about the EDVI Act. This is a piece of legislation that Prevent Blindness and many other organizations has been pushing for quite some time now, and we're going to talk to Rachel Sherman-Presser, Manager of Government Affairs and Advocacy, and Sarah Everett Brown, Senior Director of Government Affairs for Prevent Blindness. So first of all, I'd like to welcome you both to the program.
Thanks, Chris. It's great to be here.
All right, so why don't we dive right into it? First of all, I'm sure I haven't really done justice to the EDV Act. And since it's something that is so potentially important, could one of you identify yourselves for our listeners and tell us a little bit more about what the Act entails?
I can go ahead and start. Thank you so much, Chris. It's great to be here. I'm Sarah Everett Brown, Senior Director of Government Affairs. And the EDV Act is a piece of legislation that Prevent Blindness has been working on in Congress. We're very proud that this is bipartisan legislation that would establish grants for states and communities to improve, develop, and manage systems of care for children's vision and eye health, and really emphasizes that early detection and intervention. The approach that the EDV Act seeks to accomplish is that it pushes early detection practices, and this could be anything from screenings to basic public awareness about children's vision and eye health, and connects children who need eye care to an eye professional to receive diagnosis and treatment. An important component of that is the referral piece. So once a child is identified to have a potential vision problem, that child is then referred to eye care for diagnosis, treatment, and services. But also there's a component that the EDV Act pushes, and that is to follow up on vision care. Once a child is referred to vision care, we want to make sure that they actually do receive that care at the back end. So really by tying all of those components together, the EDV Act creates a strong system of care for children's vision and eye health, and it builds on that long-standing partnership between the federal government and states through grant funding and partnerships, as well as technical assistance. So in case any states or communities do not receive that grant funding at first, they can still learn how to best approach children's vision and eye health in their states and communities, and learn from other states about what is working for them and employ those practices on their own.
I think it might be useful to paint a bit of a picture, because that's messaging. Sarah and I talk about this all the time. That's messaging that really makes a lot of sense when we're in DC, when we're meeting with offices, but I don't always think that that is something that everyone at home can understand. And so I just want to kind of map that out a little bit. So right now, let's say you live in a state where a child receives a vision screening in school, and they fail that vision screening, and a note goes home to the parents and it says, your child failed a vision screening, they should be referred to care. That referral piece, that's the referral piece that Sarah is talking about. And it's very challenging for us to know how many students or children are being taken for that follow-up care. And if they're not being taken for their follow-up care, why aren't they being taken? Was there a cost issue? Is there no provider in the area? Maybe a note went home and the parents didn't understand it, maybe because the language wasn't something they understand. And so right now, there's kind of this big nebulous black hole where we know that some students are getting vision screened in schools, at pediatric appointments, by mobile clinics, and then some of them are getting referred to care and some of them aren't getting referred to care. So that system of care that Sarah's talking about is really about the whole map, the whole journey that a child would go through from the start of getting that first vision screening all the way through accessing treatment and care.
Very good. Thank you for adding that. And in fact, on my end, there's something that I'd like to emphasize. And if either one of you wants to speak to this, so much the better. But when we talk about something like this, I know it can sound to people like this huge, massive undertaking. And in a way it is, that it can touch the lives of people all across the United States. But this is not only a project that does not really require a ton of money compared to the federal budget, but that this is based on, to some extent or partially inspired by, a successful program that is run with the federal government and the states to test children's hearing that has been going on for a few years now. So can you address that?
Absolutely. I'll take a first stab at that. So you're right, Chris. The EDV Act is modeled after a program that has been very successful for children with hearing disorders and communication disorders, which is the Early Hearing Detection and Intervention Program, or the EDI program. So if you see some symmetry between EDI and EDV, hopefully these will be carbon copy programs of each other someday, because they're carbon copy bills, essentially. The EDI program implements that system of care, which is really reliant on that first early step of identification. So in the hearing space, children are tested for hearing disorders as soon as they're born, and ideally In the hearing community, that system of care looks like the child being screened at birth before they reach 1 month of age. And if they fail that hearing screening, ideally they are referred before 3 months of age. And once they are diagnosed with something, they should be receiving specialty audiological and communication care by age 6 months, because in the hearing space, that's when we start seeing impacts to communication and being able to take in information through that particular sense. Vision follows a little bit of a different suit because vision is a different sense than hearing and requires different patterns of screening and referral to care and age-appropriate guidelines for screening across a child's lifetime. However, that same essence of a system of care is implemented for vision as we saw in hearing. And the reason why we thought this program was successful was because back in around the early 1990s, when this program was not in place, only about 10% of infants in our country were screened for hearing disorders and then referred to specialty care. And because of the interventions of EDI that has been very successful, that number is now up to 98% of infants screened and then referred to hearing care, many of them receiving that hearing care on that system of care of age appropriateness that the hearing community has set up. So this is really strong success. We've seen Congress respond to it very well over the last 25 or 26 years that it's been legislated by reauthorizing it, increasing its funding, and it's really enjoyed by the public as well because now 59 states and territories and communities receive funding through EDI. And we certainly hope that we can envision the same thing for the EDVI Act, though we're starting at a smaller level than what the hearing community is being funded at. I imagine at some point we'll get there, but some of the challenge that we're seeing in Congress is that even if it is important, even if it does follow a public health program that has been wildly successful, it is still new spending. And the priorities in Congress that we're seeing are just not on new spending or new healthcare programs.
Yes, I recognize that it's a very difficult atmosphere right now, and I'm sure most of our listeners do as well. Let's talk a little bit about that. We have, as you've mentioned, bipartisan sponsors and support for this legislation. But one of the things that's changed is during the course of this year, there's been a great deal of movement all across the country to gerrymander seats for political purposes. And one of our sponsors will not be coming back next term. Can you speak a little bit to how this might affect the future of the EDVI Act?
Sure. Yes, we're so sad to lose Mark VC. He's been such a wonderful member to work with, an extraordinary champion of children's vision. He can speak to his own challenges as a child and learning with a vision disorder and how that affected him. And he's just been a tremendous member to work with, so we're very sad to lose him. Looking forward into the next Congress, he's still there, he's not gone yet. We still have some time to, move and advance EDVI in this Congress, but, next Congress, we're gonna have to see, what the voters decide as far as who they send to Washington and, kind of start over with finding another member to work with. And the good thing is right now the EDVI Act has 27 co-sponsors, quite a few Republicans and also many Democrats. And so anytime a member supports this legislation, that becomes somebody that we can work with to help continue its advancement. So even though we're losing a really strong member, we do have a lot of great members who are very engaged on this issue, many of whom I'm sure would be very pleased to line up and lead on this legislation when we have to reintroduce it next Congress.
Great. Now, one thing I was curious about, and one thing listeners may not have gotten, and I want to emphasize for them, is the way the legislation is structured so that states could, if they needed a new program and they did not have money for it, they could use that money to help create a new program. If they had existing programs that they felt were working, they could use the money to potentially just expand their existing programs. The states had a lot of ability to choose what was most effective to them. And this is something that I think that a lot of voters across the spectrum do have some interest in right now. So can we talk a little bit about how that might work?
Chris, thanks for that question. So the idea behind the EDVI Act is, we're not intending to say to states and communities that you have to employ this one particular practice over another. We're not saying that these are the guidelines that you need to follow. We're not telling states what to do. What we would like to see is more uniformity in what early detection looks like. So making sure that screening procedures and policies are age appropriate, they're happening at the right time, and that they are targeting the children that need it the most. So we want to ensure that states have that evidence-based, well-informed guidelines and best practices to screen children in the right way and to make sure that they are collecting the right information. To Rachel's earlier point, to help us understand why a child might not be receiving eye care. And early detection goes in so many different ways beyond just screening. I'll give a personal anecdote for just a moment. I was 14 when I first entered the eye care system. I said to my mother, the leaves on the trees look very blurry, and she said, it sounds like we need to get you to the eye doctor. Because she knew that, and she knew a sign that I was experiencing vision problems, she knew to connect me to care. And sometimes early detection can be just as simple as that, helping people understand what are some of the signs that a child might be experiencing a vision problem. That is part of early detection, and a lot of states don't have the resources to even do basic public education to parents, to families, to teachers, to early child care professionals. And some of them are at the front lines of observing some of these problems in children and how to connect them to the right eye care at the right time. So, for example, states across the board, we're seeing them employ things that are techniques and policies that are so much further ahead of the game. They are based in evidence. They are very well equipped, and they might just be missing a link in the chain in that system of care that we talked about earlier. They might be referring children to eye care, but are they following up with them? Are they collecting data on rates of screening? Do their providers have the right evidence-based tools and resources to ensure that that child is being screened and connected to care in the right way? And also, are states being accountable for the money that they're receiving to employ this sort of work? And what the EDV bill is wanting to do is really just tell a state, you know your community best, you know your population best, and how to address their needs in the best way. What we're trying to do is create a little bit more capacity so that you can continue to do those things, make improvements where they are needed, and do that in perpetuity to make sure that this is not just a one and done, we're screening kids and then next year they'll be fine. And we're making sure that children who might have been screened 6 months previously but is experiencing a vision change in a year or two is still connected to eye care no matter how old they are, but it's done in a way that suits their needs and again connects them to the right eye care at the right time.
The National Center for Children's Vision and Eye Health has new vision screening training modules, and I had the benefit of reviewing some of those. Something that I think is really important that Sarah just said is that, there's new evidence-based practices that come out, and not everyone is aware of those. And so one of the ones that I learned about is, some people when they're doing vision screenings, you have a child, cover one eye and then cover the other eye, and they're kids. Like maybe someone kind of like fudges it a little bit, maybe they move their hand a little bit, and it looks like they did pass the vision screening when really they didn't. And one of the tools that we know we should be using are these kind of they almost look like Mardi Gras glasses. Like you put them on a kid's face, it covers one eye, then it covers the other eye. It's a lot harder for a child to cheat. And so it's really challenging if a nurse doesn't have access to those tools, or if someone doesn't even know they should be requesting those kinds of tools. They're doing the best they can with the resources that they have. And this is really saying, how can we equip them with even better resources to really support children?
Thank you, Rachel. And we touched a little bit on your role as far as doing grassroots outreach. Based on what you folks have been saying, I'm sure that some of our listeners are now finding themselves in favor of the EDV Act and wanting to support it. Can you tell them what sort of things that they might be able to do to help EDV move forward?
Yeah, absolutely. Sarah and I, we go to the Hill, we meet with people, we talk about EDV. I think we do a great job. People definitely respond well to us, but nothing moves the needle the way advocate voices do, especially if you are a constituent of someone's state or district. So, Sarah and I can be there all day, every day. And then the day that we bring an advocate, that's the day that's really going to matter. And so I would say there's a few things. The first one is we have a legislative action center on the Prevent Blindness website. And we've already written messages. So all you have to do is you go on the page. We have an advocacy alert for EDV. You type in your address. It pulls up who your member of Congress is. We've already pre-written the message, but you can edit it. So let's say, Sarah just shared her story. Let's say you have your own personal story. You can type that in. And then you just click send. That's going to go to whatever health staffer is working in an office. They read every single message. And something that I hear from advocates sometimes is, oh, I sent a message and I just received like a foreign response, so that must mean it didn't work. And I think a lot of times with advocacy, we think about it a little too much in the short term. We're like, okay, well, I did one message and maybe I didn't get a personal response or I didn't get the response I wanted. So that's it. Advocacy is done. I'm throwing in the towel. I'm feeling really defeated. And, what we know is that, what health advocates and disability advocates know is that advocacy takes a long time. EDV was introduced in the last Congress and was it 10 co-sponsors, Sarah? 11? 10?
It's been a little while.
I got 10 or 11. And, we're getting towards the end of this Congress and we're at 27 and we still have a handful more months in the year. And so, this is really about building a strong foundation. So I would say one of the things that people can do is they can go on our website, they can reach out to their member of Congress, reach out often. You could reach out every month. And then if you're interested in getting more involved, you can sign up for advocacy alerts. And then that gives us an opportunity to send emails to you when we think there are moments that would be really meaningful. Like maybe Congress is about to go on recess and we think it's a great time to reach out to your member of Congress back home. We'll send you all the tools and tips on how to do that. And then finally, what I would say is if people really want to make an impact, they can always show up at a district office or they can come to DC. Sometimes we will send out emails to people in our network and we're saying, oh, we're trying to reach a congressperson in West Virginia. Who do we know who lives in that district? And we want to bring you to DC to have this conversation. We don't know that someone exists if they're not a part of the advocacy network. And so I would really recommend that people sign up for advocacy alerts and to put their full address in. And then the last thing I would say is if you wanted to go to a district office, you could send us an email at advocacy@preventblindness.org and say, I want to go to my district office. Do you have any materials for me? And we'd be happy to send materials. There's also materials on our website. So tons and tons and tons of ways to get involved. And I would really just encourage advocates to not get discouraged if it feels like they do one thing and then that one thing doesn't go their way.
Thank you, Rachel. That was very good information, and I think also a tailor-made opportunity to remind our listeners about the Prevent Blindness Aspect program. For folks who are really looking to get involved in your advocacy, we run a regular program that is free of charge, and folks can enroll in the program and learn how to use their own personal stories for advocacy. They can meet other advocates from all different walks of life. It's something I've been involved in, and it was a powerful experience. Literally, everyone I have spoken to tells me that it has been a life-changing experience for them. So you can find that information on our website, preventblindness.org. Now, I think at this point, it's probably good to talk a little bit about the future of EDV, because most outsiders are not really aware of some of how the policy works in terms of how long the terms of office are, when exactly they end, when the new elected officials will be coming in, and how this affects legislation that has already been introduced. So let's just talk a little bit about what might be likely in the near future.
Sure. So thanks for that question, Chris. Right now I'm looking at the calendar and kind of shaking my head a little bit because this Congress is already starting to look at what happens at the end of this year. Prevent Blindness has this goal of having a companion bill introduced in the Senate. Companion bill meaning that it's an exact copy of what we introduced in the House that is also introduced in the Senate, which is part of congressional procedure to do that, to pass legislation. And, because it is a midterm election year, the entire House is up for election every 2 years, and 1/3 of the Senate is up for election also every 2 years. And so what we're seeing right now is that because members are, on both sides of the aisle and every 2 years, no matter who's in power, right about this time is when legislators start looking at how do I sell my constituents on electing me to another term of office? And in situations like this, we start seeing that legislation continues to be viewed kind of with within that microscopic lens of, is this good for my voters? Is this good for me to get reelected, to show that I care about my district or my state? Again, both parties do this. There's an opportunity in there in that with any bill, a legislator might take a look at this and say, yes, this is good for my district, this is good for my state, I'm going to lead on this, I'm going to work on this bill. And so we might see more co-sponsors, we might see some more members of the House and Senate start to demonstrate some interest in supporting our legislation. But this also really does put a clock on things too. At some point, legislators need to focus on winning their next term in office. And so sometimes they might use that as a reason to buck things into the new year and say, let's look at this in the new Congress and see what happens in November. I'm kind of joking a little bit because right around the winter holiday season, we start kind of saying, let's revisit this in the new year. And Congress likes to employ that rule in July. We have, 5-6 months left in this year, and we're already having to start planning for 2027. But that's just kind of the way things are here in Washington. And sometimes that, comes a little bit sooner. Sometimes it comes a little bit later. But that's the mood that the Congress that's in office right now is feeling. And when we get to 2027, if the EDV Act has not been passed, if it has not been introduced in the Senate, if the EDV Act does not get added onto one of the big omnibus bills that Congress tries to rush through at the very end, and if ultimately the EDV Act is not signed into law, we will need to look at reintroducing that in the next Congress. And when a new Congress is sworn in on January 3rd, that means the clock restarts on the EDV Act. We need to reintroduce that bill and start the hard work of getting co-sponsors and building momentum in the House and the Senate all over again. So that's why you hear Rachel saying, reach out to your member and support this bill and let's get this done, because we have to start the clock again every 2 years. And so even though where we were 2 years ago when we introduced this bill for the first time, to Rachel's point, there was only just a handful of members that had supported this, and now we have more than doubled that number. That still signals that there's tremendous progress, but we still need to start over again. And so it really helps us when we hear messages of support and stories from advocates, because that really can help carry that momentum into the next year, and hopefully our job won't be as hard to get it back to where it was.
You mentioned something about, maybe people who are listening don't understand the legislative process. I definitely, when I started this job a little over a year ago, I thought I was well informed. I learned how wrong I was and how not well informed I was on the legislative process. And one of the things I've really learned is that, there's never such a thing as a stupid question ever. And the only way to really feel empowered, it's a cliche for a reason, knowledge is power. And so I think if there are people listening and they're like, well, I'm really nervous to reach out because I don't really understand the process. You can reach out to Prevent Blindness. You can Google things. You can do some research. And that really is the best way to equip yourself as an advocate to say, all you really need is your story, but it really helps to build confidence when you understand what it is that you're advocating for and you understand the process. So I would really encourage people to not be scared. Schoolhouse Rock existed for a reason because so many of us didn't understand the process. And so really not to be intimidated because, the people that we're talking about, they work for you. They work for their people in their district, in their state. You're the boss and you should really treat them like that. I talked to too many advocates who are like, I could never reach out to my member of Congress. And I'm like, well, then what are you paying them for? Call them, ask them to do things. This is how the process works. And so I would really want to empower people listening to say, I'm going to advocate with Prevent Blindness. I'm going to advocate for the EDV Act.
Excellent point. And I'm actually going to share a very short personal anecdote because we're talking about how those can help. For everyone who has an interest in reaching out to their elected officials or staff or anything along those lines. As a lifelong journalist, when I first started in this industry, one of the first things that my editors taught me, I wrote a story and some people wrote in about the story. I was pleasantly surprised. And they said, the rule of thumb in the business is for every person who reaches out, 10 other people felt strongly that way, but they got busy, they got tied up, they just didn't get a chance to actually do it. So anyone who reaches out, your communication counts for more than you know. And on that point, I'll just ask you both, Sarah, Rachel, if there is anything you would like to add.
I just have one super fast point I just want to make, and that is to shout out to our partners who have endorsed this bill. We have just over 115 organizations across the United States who have signaled their support. And these are groups that are not just in the vision and eye health space. They represent school nurses, they represent ophthalmologists, optometrists, children, families, social justice issues, pediatricians. We're so excited to have them on board. And so if there's any listeners who are out there who represent a small community organization, you do not have to engage on legislative advocacy, you don't have to do lobbying, you don't have to have a lobbyist. But if you are interested in lending your organization's support, your organization's voice and resources into helping us get this done, there is a form on our website, or please reach out to advocacy@preventblindness.org with your endorsements. We are more than happy to work with you.
I'll just say, Sarah knows that she's heard me say it in advocacy trainings before. One of my favorite movies of all time is Ratatouille. And, the main point of Ratatouille is anyone can cook. And I think that the same applies here. Anyone can be an advocate. So I hope that anyone listening who maybe at the beginning of this was like, well, I can never be an advocate. That's not the kind of person I am. I really hope that you remember that anyone can be an advocate by just doing it, by being an advocate.
Thank you very much. These were all excellent points and great information, and I know you're busy, so thank you for taking time out of your day to come and talk to our listeners.
Announcements.
Join us in September as Prevent Blindness observes Sports Eye Safety Month. Prevent Blindness observes this coming September as Sports Eye Safety Month. According to a study published by the American Academy of Ophthalmology, American hospital emergency rooms treat about 30,000 cases of sports-related eye injuries per year. The good news is that most of these injuries are preventable. Join us next month as Prevent Blindness observes Sports Eye Safety Month, plus links to helpful resources. We look forward to joining you again in the September episode.
Listen to the podcast from our website at preventblindness.org or subscribe to it on all major podcast services, including Amazon, Apple, Spotify, and YouTube. This has been your announcer, Corey M. Snow.
Thanks, as always, for joining us for another episode of the Prevent Blindness Focus on Eye Health podcast. We invite you to come back and join us for our September episode. Prevent Blindness observes September as Sports Eye Safety Month. Many sports-related injuries are preventable, and we'll be sharing information to help you protect yourself and your vision. Additionally, we'll have a story about improvements to a free device that can help members of the blind community access free audiobooks. As always, we'll have news and announcements of interest to the blind and low vision community. Do you have comments or suggestions? If so, you can contact us at podcast@preventblindness.org. We can't always reply to every email, but we read every one. I'm your host, Christopher Hoard. Until next month, share and enjoy.